Have you ever gotten any pushback from husbands or that they may not know? Because I feel like there's a big misconception of like, oh, physical therapy, that's for sports. Oh, physical therapy, that's when you have surgery. But I don't think a lot of people associate it with pregnancy or all these things. What would you say to someone who may be experiencing that?
Like if their partner is questioning if this is really what they need. Yeah. It's been really cool to see the evolution of this with partners, with even parents or physicians. Initially, I did hear a lot of pushback. So when I started the company, I was the one doing the initial call to screen them, make sure they're appropriate for therapy, and then explain to them what I could do and what it costs and what it looked like. There were times where I had the husbands on the phone, and they would, like, I don't know, let me talk to the doctor, said no, or, oh, you don't take insurance, so I don't think so, we're going to go elsewhere. I don't know if it's increased awareness in the community. I don't know if it's because we've developed this reputation over years where we have earned the trust of other care providers, but we are more and more often hearing husbands be like, I've been telling her to get this taken care of, and no, she needs this. I'm not even telling her, like, this is her Mother's Day gift. I'm gonna get her this because my friend told me that you helped his wife and she just felt better. I will say that they are very on board if we explain that we can help with pain with intercourse. They typically say yes. And that's fine. Like, I'm great, love it. Yes, high five. Have a healthy sex life. You should. And I'm seeing a trend where they're wanting to support their wives or their partners, even if that's not the only thing.
That's beautiful.
Even if it is moving around. We had one guy recently call in. This is an example. He called not without talking to her, not like he didn't have her consent, but it was like he called and he spoke to the therapist that works with me who does the screenings, and she told the rest of the crew, she's like, I just had the best phone conversation with this husband. He said, listen, Dr. Cassie, I did this to my wife and she's miserable. He's like, I didn't mean to. We have 2 kids. And she was like, okay, say no more. I got it. He was like, yeah, but now she's pregnant again and she's miserable and she hurts and I heard you guys can help her. So it is like really turning a corner. I know, right? So cute.
And I mean, it does help that if a woman's going through that and it's making it painful for her to have intercourse, that like everybody can be happy. They can be happy.
Yes, he's directly involved with that outcome. Yeah, absolutely. Yeah.
What should men know about this process? I feel like more men now are more aware or more, I don't know, gracious. Then there's some that they don't even know.
Sure, yeah.
What should they know about this whole process, or how should women communicate to them? Sometimes we don't even have language, or we don't know how to communicate like these specific things. You're the doctor. You've seen this before. What would you say?
Yeah. I mean, from a physical therapy perspective, I would say this treatment type is science-backed, research-supported. It's been evolving over the years, and we use the most up-to-date strategies so that we're effective in what we're trying to achieve. So to say you should get the outcome. I mean, we listen to your problem in depth. We really understand what's going on with the body. And if we say, yes, we can help you, we can help you.
I love it. So before even signing up, is this program for everyone, or how does the screening work?
Yes. So we do screen patients before we start working with them, because we do need to know from a clinical side. Sometimes she'll tell us something that's going on, like say she mentions that she's on pelvic rest, which is not bed rest, but it might mean certain things like she cannot have intercourse. Sometimes physicians will use that term if they don't want her exercising in her pelvic floor or maybe her hip musculature at all. So we want to get that information so that we can connect with the physician before the eval, but we're still evaluating her.
Got it.
We just need to know. Sometimes they're calling in and they're talking about a problem, and they actually have something else going on, and we want that cleared before we see her.
Got it.
So I had a woman call who was telling me about her pain patterns, and I was like, this does not sound right. She had stabbing pain in her mid-low back, kind of sometimes my side, and it comes out of nowhere. Out of nowhere? Like, are you getting up from a chair? Are you rolling in bed? No, it's just like this stabbing pain out of nowhere and it knocks me to my knees. Does it have anything to do with when you eat? And she's like, now that you mention that, it's like an hour after I have a meal. I'm like, okay, I feel like I might want you to go to the ER because one of your organs might be really mad. Like, there are times where we get gallstones, we can have appendix issues. There's an overall slowed metabolism during pregnancy. So we process our food much slower. That's why we can have constipation more often, bloat. So yeah, organs, we're more predisposed to stones, kidney stones even. So, and then the other thing is I've had women call in who are in labor and they're like, I'm 39 weeks and my back is killing me. Can you still help? Absolutely, we can help. Let's ask a few more questions. And then she's like, it's like every 5 minutes, something's just grabbing my back. And I'm like, how long has this been going on? Like 4 hours. Okay, let's call your midwife. And if you get a gush of fluid, that's your water breaking. Like it can present in different ways. So sometimes women don't know they're in labor, which I don't blame them. You've never been in labor before, you might not know. Yeah. And you might just think you're having back pain. Yes, so we screen them ahead of time. We make sure they understand most of what we're going to do. So they're consenting, they're excited, they're like really understanding the concepts behind it before we come to their home.
I love that. Yeah. So I'm glad to know that there's actual support or help to prevent it or to recover it, like to come back to wholeness.
Yeah, back to homeostasis, dry pants and pain-free sex. Yeah.